Michael T. Hayes is professor of political science at Colgate University and author of Incrementalism and Public Policy, and The Limits of Policy Change. Michael T. Hayes, special to Syracuse, come in recent days. Kamala Harris and other Democratic presidential candidates have begun to rethink their earlier support for Medicare for all. Even Elizabeth Warren has softened, acknowledging that there may be more than one path to single-payer health care. While these shifts appear to be driven primarily by political concerns, many voters oppose elimination of private insurance plans. Adding a public option to the Affordable Care Act is not just good politics. It's good policy as well. Idealistic attempts to solve complex problems in a single step, like Medicare for all, are virtually impossible to analyze rationally, both before and after passage. By contrast, incremental reforms, like the public option, are much more likely to work effectively because they take full advantage of available information. If a new policy changes a lot of things at once and then works badly, how can we know which of the many changes is responsible for the problems we now see? Throwing out the old system entirely and replacing it with a new one makes this task even harder. By contrast, a new policy that makes only one or two changes to existing policy is much easier to evaluate and correct. Adding a public option to the Affordable Care Act makes just one significant change from current policy, albeit a very important one, so the consequences of the new policy should be easy to evaluate. Incremental reforms build on past policies rather than blowing them up. Where existing policy seems to have failed completely, policymakers sometimes opt to take a calculated risk even though there has been no increase in their understanding of the problem at hand. Policies going well beyond anything we've tried before may be worth trying when policymakers view existing policy as too broken to build on. But is our current health care system really so badly broken that we can't build on it? Survey evidence that most voters are happy with their health care plans strongly suggests that we are not really in a crisis. Moreover, characterizing the Affordable Care Act as too broken to fix unwittingly echoes the Republican talking point that the act needs to be repealed and replaced. Do Democrats really want to make that argument? Adding a public option to the Affordable Care Act allows people who are happy with their private insurance to keep it. It also addresses the main problem plaguing the act, the lack of competition in some areas, leading to higher premiums. With the addition of a public option, everyone everywhere will have more than one plan to choose from. Local insurance monopolies will have to lower premiums in order to be competitive. While adding a public option is the logical next step, it isn't necessarily the last step. Any new policy change will help in some ways and hurt in others, and subsequent legislation will be required to address weaknesses or unanticipated consequences. Incremental policy reforms facilitate this inevitable process of evaluation and correction, making rational improvement possible. Also in opinion, NYS fare bus loop. Why do we have to do the fare backwards? Your letters let's block ads.